Hello, everyone, and welcome to the call. It is my pleasure to welcome everyone to Jewish National Fund's Compassionate Care, COVID and Beyond, a Doctors for Israel conversation with Dr. A.L. Sela. For those of you who are new to Jewish National Fund USA, you may know of our work planting trees and making the desert bloom, but we do so much more. We build medical facilities, housing infrastructure, parks, schools, and help people with disabilities. We also support economic development initiatives that pave the way for hundreds of thousands of Israelis to move from the crowded center of the country to the Negev and Galilee. The format of this program will only allow participants to see the featured speakers. All participants are muted and are unable to unmute themselves. However, during the program, you can submit questions to the speaker through the chat feature. You can switch your feature to speaker view, a button located in the upper right-hand corner, which will show the speaker talking in a larger view on your screen. The program will be recorded. Now I turn this program over to Ari Rubenstein. Thank you, Ari.
Thank you. Good afternoon. I am Ari Rubenstein, and I am a proud member of Doctors for Israel. I also serve as a member of the New York JNF Future Board and Go Northeast Task Force. First and foremost, I hope you and your family are healthy and well during this challenging time. We are so grateful to you, our healthcare community, who has been and continues to be on the front lines in fighting this pandemic. For the past 14 years, I have served proudly as an EMT and paramedic in New York City, a member of the Special Operations Hazardous Materials Division at New York Presbyterian Hospital, and a paramedic for the Department of Health National Disaster Medical System. While I've worked in New York through SARS, swine flu, Zika, and Ebola, COVID-19 is obviously different for all of us. The past 4 months, like many of you, have been spent between the hospital and ambulance and sequestered in my apartment or a hotel. I've seen colleagues get sick and die and cared for hundreds of COVID patients in New York and on deployment in Georgia. As you will hear shortly from our speaker, one of the characteristics that makes our work different is the ability to separate the individual from the disease or injury. But we know these patients are not faceless. Each comes to us with family, history, and potential for the future. There are no friends or enemies on the stretcher or hospital bed. Astronauts describe the experience of going to space as a realization that we are all connected in a small world. Healthcare workers have the same experience in anatomy class or cadaver lab. Similarly, COVID-19 has been a much needed reminder of our equality during a time of discord and disagreement. This disease cares not about gender or race or socioeconomics. We've been connected in our separation through Zoom calls like these and through a larger community of caregivers. We've been applauded in cities throughout the world and sometimes left to feel insignificant and small all over again. Science and reason are our currency. The world just has to decide whether it wants to trade with it. And we have seen that WebMD and Dr. Google offer no replacement for bedside manner or beneficence. In a city of millions of people, I could be another number, another faceless drone commuting to and from work, or I could become an active member that not only engages, but improves society. And one step further, I could go into homes of others during the scariest, most stressful moments and provide not just medicine or apply direct pressure, but offer a sense of calm. In a way, be the hand of God just with a nylon glove. If Jews are committed to be or Lagoyim, lights unto the nations, healthcare providers are the filament in the bulb. This is not just a profession or a job, but a calling. After 16 years on the ambulance, I know it is uncomfortable for EMS workers to receive thanks. After all, we're just doing our job. But I can't think of a better audience with whom to share my gratitude, not just for being here today, but for years of service to your fellow man and woman, and continued blessings that your hands will be guided to good. While we navigate the ever-changing landscape in America, our support continues to be with our Jewish National Fund affiliate family in Israel. Despite everything going on in our world, JNF USA continues to serve as the bedrock of philanthropic support for the land and people of Israel. We continue to supply laptops for children with disabilities from low socioeconomic backgrounds, helping them to continue their treatment and studies remotely. We continue to help small businesses in the North survive in Israel who are suffering from the lack of tourism. We continue to sponsor food and necessities for senior citizens. We continue to support job seekers in the Negev and Galilee find employment. We continue to provide the highest level of medical care to those living in the periphery, despite financial, geographic, and COVID-related challenges. In such unpredictable times as today, I am proud to say that Jewish National Fund was there yesterday. We are there today, and we will be there tomorrow. I want to thank each of you for your incredibly generous support to Jewish National Fund as a member of the Doctors for Israel Society. If you have not yet done so, I encourage you to make your $1,000 minimum 2020 commitment to the Jewish National Fund. It is now my honor to introduce our guest speaker and moderator for today's call. Today's moderator will be Stephen Shalowitz. Stephen is the host of Jewish National Fund's USA podcast, Israelcast, and for the last 8 years, he has produced and hosted the One Way Ticket Show podcast. Dr. Eyal Sela, director of Otolaryngology, ear, nose, and throat, head and neck surgery, joined Galilee Medical Center's administration in 2013. Since then, Dr. Sela and his inspiring staff have been leaders in the medical revolution, sweeping the Western Galilee by providing new and innovative services to the residents of Israel's northern periphery. He also acts as a key speaker for visitors and media outlets wishing to understand Galilee Medical Center's treatment of victims of Syrian violence. Dr. Sela is head of one of the main departments that cared for many of the 3,000 patients who sought care at Galilee Medical Center from March 2013 through the end of December 2018. Dr. Sela is a shining beacon for Galilee Medical Center's driving focus, people-to-people medicine, or healthcare for all. I am pleased to welcome Stephen and Dr. Sela. Stephen, I believe you're still muted.
Yeah.
I just unmuted.
Perfect.
Can you hear me? Okay. All right. I always repeat myself anyway, so I'll even repeat myself now, even unmuted. I said, Dr. Sela, it's lovely to see you again, and thanks so much for joining us. A very good evening to you.
It's a pleasure to be here.
Right. Well, listen, I first want to echo something that Ari said about your work with those that were caught up in the Syrian civil war. And for anyone that's on the call, if they have not heard the episode yet already, we actually did an extensive interview about your experience healing those and working with those that were caught up in the Syrian civil war on the Israelcast podcast. And that's episode 61. So jnf.org/Israelcast, episode 61, where people can learn more about your work and the amazing work that your colleagues did at the Galilee Medical Center. So once again, congratulations and kol hakavod. We really want to focus this conversation, however, on the coronavirus, on COVID-19. I know you have a presentation, so I'm going to let you do a deep dive into your presentation. I'm going to hand it over to you. And once you're finished, then let's begin our conversation. How's that?
Perfect. Sure.
And also, let me just interrupt once again. See, I told you, I repeat myself all the time, muted or unmuted, is that once again, for those on the call, if you do have any specific questions, I will be checking the chat and I will be taking them right after Dr. Sela is finished. So Dr. Sela, over to you.
Perfect. Thank you very much.
Sure.
And Stephen, so do you have the presentation there?
Yes, Sarah is going to be uploading it right now. And you'll give instruction to Sarah on what you'd like to move on. There you go. Over to you.
Perfect. So I would like to do it as a conversation. So if you have any questions and you want to stop me, please feel free to do it. So
Okay.
Thank you for introducing me. I'm working at the Galilee Medical Center from 2013, and this is actually the hospital. You see it right there. If I point with the arrow, do you see it on the computer or no?
Yeah.
Yeah. Okay. So this is the Galilee Medical Center. That's not a swimming pool there. That's the helicopter land site. And over the mountains at the top, you see Lebanon. You see the border with Lebanon. So we are about 6 miles from the Lebanese border. And actually in the past few days, the last 2 days, actually, it's really hot. And you can hear the guns and the bombs from both sides, unfortunately. There was an attempt for Hezbollah to enter the Israeli border, and fortunately we stopped them. We serve a population about 600,000 people, and we have about 720 beds, over almost 70 departments, which makes us the largest hospital in the northern part of Israel, except Rambam Hospital, which is situated about 50 kilometers, which in miles, I don't know exactly how much is it, south to us in Haifa. So my first encounter was actually in 2006 in the Second Lebanese War, when I was a medical officer and evacuated patients and wounded soldiers to the Galilee Medical Center. Can we move on? The slides. Great. So actually, we are prepared for mass casual events and threats that we are used to, not like in New York or in the States where usually we receive major road accidents as every other hospital. However, we do have, and we prepare all the time for terrorist attacks and missile attacks. This is specific to the Nahariya Center, to the northern part of Israel. Every 5 to 6 years, we have a war in around average. And every winter, we have the flu, which is coming, and we are overpacked and full of patients. But we also take under consideration industrial chemical spills, because we do have a very big industrial area in the northern part of between Haifa and Nahariya, and earthquakes, which we have once or twice every year in the northern part. But we never took a scenario, a pandemic scenario, into our consideration, like the COVID-19, which caught the whole world, as we say, with the pants down. We didn't know how to deal with it because we were not prepared. Can we move on? More. Yeah. No. Yeah. One back. Yeah. So what did we do when we saw that the coronavirus is coming on global scale, and it's coming to Israel? So we did every day a brief briefing with the status that we have. We immediately, Israel started purchasing medical equipments from masks to visors, bed sheets, gowns, and to ventilatory machines that you all know was missing global wide. The Mossad went into this operation to bring ventilation machines from all over the world. We analyzed and learned from other countries and tried to avoid catastrophes that happened in Italy and China. Immediately we started in personal training with the staff that we have, from nurses and doctors, so they would know how to operate patients under anesthesia. We transformed our facilities and we adjusted them to accept and contain patients. Can you move another slide, please? Do you hear me okay, by the way?
Yeah, it's perfect.
Okay, so one slide backwards. Yes, so as you see here, we completely transformed our hospital And we built contained areas, and we transformed them with filters and oxygen and all the facilities that we would need for anesthetized patients. For example, this room up here on the right hand upper right corner was a regular patient room, which was transformed for intensive care unit. Can you, another slide? Okay, so what you see here is that we built walls with, as you see, those gloves here, which are, patients would be on the other side. We contain them as a red zone, and red zone, only authorized personnel would go in with guards and security. You can see the beds for waiting for the patients to arrive. And as you see here on the right-hand side, upper right, you can see all the computers with cameras that you can monitor every patient, and you can see on the computer on the right side that you can see all the vital signs for the patients without entering the room, and we can speak to them. And this is the control room, which is actually occupied 24/7. And this is one of the corona departments. We actually built 2 of them like this, and in the first wave, and between the first wave and the second wave, we're transforming more departments, like my department, the ENT department, is now fully capable to receive corona patients if needed. So if the 2 departments are completely occupied with coronavirus, we're going to evacuate my department and the ophthalmology department, and we can accommodate those patients. We made a separate entrance for the patients with positive COVID-19. And as you can see, the ambulance, the Magen David Adom, is bringing them not through the regular ER that we have from the side, and it's contained, and they go immediately straight to their COVID-19 department. Next slide. And also the labs, we immediately equipped our labs with state-of-the-art microbiology exam and the PCR, what's needed to be to check the patients for the COVID-19. We did get funds from the government for a change for this rapidly growing disease. And actually we managed to perform 15,000 tests in the hospital for patients within the hospital and from the community that came to us, including staff members that were exposed to the virus. Next slide. I'm about to finish here. So in the first wave, we have 73 patients in our COVID-19 departments. We did diagnose a lot of patients, but we send them to hotels or to the home quarantine. But those that needed hospital care, there were 73 patients. 25% were over 79 years of age, and only 1 patient actually died from the disease, which was 92 years of age. Next slide. So in the second wave, actually, which started around July 12th, reopened the corona department, which has 24 beds. The second department is not open yet. Currently, we have 15 confirmed patients. Last week we had 24, but we released them for home care. And the big number was that we had 282 staff members in home isolation overall. And actually most of them were from the second wave. We had a week ago about 182 staff members in home isolation because of exposure to the virus for patients that we didn't know that are positive and were in the internal medicine department or other departments. As of today, we have 120 staff members in home isolation, which is a very big burden on the hospital because we're lacking of staff to treat those patients and the regular patients. Next slide. Okay, so I'm open for questions now and
okay.
discussion.
All right.
I do have 2 or 3 more slides, but I'll keep them to the end because these are, well, you know, we didn't work in the corona wave. We didn't work as a regular doctors because of the quarantine. So we didn't do any elective surgeries. We did only emergency surgeries. So we had a lot of time to think. So actually we had a lot of time to research. So we did a lot of research. And by the last 3-4 months, we published over 10 articles, 10 papers in different aspects of all of them connected to coronavirus.
Dr. Sela, I'd like to jump in here with some questions. Thank you for the presentation. They actually precipitated a number of questions that I have. And again, I want to invite everybody in the group, if you have any questions, put them in the chat or the Q&A. There are 2 questions there already, which I'll get to in a second, and thanks to those participants. The one question that I have, just to go back for a second, because Israel always seems to be a step ahead of everything. It always finds a solution to a problem before it becomes a problem. And I'm just wondering, given SARS, given MERS, you had said that you never really took a pandemic into account. And I'm just wondering if you can elaborate a little bit more on that. And are there certain scenarios now that previously you may not have taken into account, which you are looking at as a just-in-case plan or just-in-case mechanism?
Okay, it's a great question. So it has several answers. So yes, we were not prepared for a pandemic, viral or any kind of disease, which is national, which has a very quick national spread as the coronavirus. This virus, if you're exposed to it, you will get it. It's not a question. The infection rate is about 80%, which is very high. It's not like the regular flu. We had, you know, after the virus came out and we looked into the protocols that are in the Ministry of Health of Israel, we saw that in the protocols like from the 70s, we are supposed to have around 1,500 ventilator machines. We're supposed to have places for generally anesthetized patients in each number of hospitals, which we didn't have. We couldn't accommodate those patients, like happened in Italy. So that's when Mr. Netanyahu, the Prime Minister, decided that we're going on a national quarantine, because if there will be a pandemic burst in Israel, we will not be able to accommodate the patients in the hospital. And during this time, unfortunately, many people lost their jobs, and you know, we are now in economic disaster in Israel. But this is a different story and a different debate. But we managed to purchase most of the medical equipment and to prepare most of the hospitals into this global scale corona viral attack.
But are there certain other scenarios just moving forward that you're looking at that you might never have considered before? In other words, is everybody doing a really deep dive once again and a relook at what could be on the horizon as a just in case?
So we're doing it in a small scale, in our microcosmos. We have twice a week management meetings, and we try to put in scenarios that we will be we might be in the near future and in the further future, but you know, each hospital unfortunately is dealing with it differently because there are no direct not instructions, but guidelines from the Ministry of Health in order to what to do. So we just, you know, build up places, we gather equipment, and it could be for earthquake, it could be for a terrorist attack, for war. But in those terms, we are actually prepared. But for the pandemic, no.
Got it.
Other scenarios, not so much.
Got it. All right. Well, listen, we have some questions that I want to get to, and I'm going to get to all of them. So I'm not going to get to them in the order in which they were received. The first one comes from James. Thank you very much. He wants to know, Doctor, when do you think we will realistically have a vaccine for COVID-19?
So actually, we do have a vaccine in Israel and in several countries, but it's not valid and it's not approved by the FDA. It's going to take between 6 months to a year from today, at least, until the vaccine will be out in the market. And I believe and I assume once it's out in the market, there will be a big battle who's going to buy those vaccines. The other thing is that we did a research, and this is actually was published, and I was sitting down with a few of my colleagues, and we said, okay, and let me ask you, Stephen, if tomorrow there's a vaccine coming out, okay, will you take it?
You're asking me. You
Yes.
know, it's interesting you're bringing this up because I had this conversation with friends over the past week, knowing we were going to have this conversation, and we all said no, that we wanted to wait. And that was
Exactly.
actually, I was going to ask you, how do you overcome that barrier? Because I don't think anyone's going to want to take it straight out of the gate.
Exactly. That's exactly the point that we had. So we had the questionnaire for 1,500 people, 500 doctors, 500 nurses, and 500 general population. And most of the doctors and the nurses, they said they would not get the vaccine. They want to wait a year or so to see if the vaccine is safe and if it's working, and then they will take it. So if the vaccine is coming out, I don't know who will take it, who will agree to take it. But then we asked another interesting question: will you give it to your parents?
And what was the answer?
Most of them will give to the parents because the parents are, you know, more susceptible for the virus and in higher risk. So then we ask a different question: will you give it to your kids?
And the answer was
no, because they're the safest.
Right.
Exactly.
There you go. We've got a lot of questions to get to. Thank you, everybody, for being such an engaged group here. Seymour wants to know, and it's related to what we just discussed, is how close is Israel to a vaccine or therapeutic for COVID-19 in terms of Israeli research?
So I know the Weizmann Institute is working on it, and they have a vaccine for animals. So it's not the COVID-19 for human, it's a bit mutated. It's actually, the vaccine can work on humans. It's not tested yet, but they're really close to finalize the vaccine. But then it has to be tested on humans.
All right. Just jumping around here, Susan would like to know, have Jordanian citizens come for treatment?
Jordanian? No, not that I know of. No.
Okay, got it.
Comes in and go. No, but we're.
Got it. All right. And then an anonymous attendee, the first to chime in here, wanted to know how effective are hydroxychloroquine, there we go, hydroxychloroquine and zinc in treating COVID-19.
So the numbers about the quinolones are different because most of the centers that used it, they say that they report that along with other treatment, it's bringing better results, but nothing conclusive that I can point and say, yes, this is a very good treatment, because we're talking about a virus. It's not a treatment for the virus. It's a treatment for the other problems that come with the virus. The virus, you have to understand, this virus, it's a very bad disease. It's a very uncomfortable situation that I saw young people, young adults, 30s, 40s, and 50s, healthy patients, healthy adults that had the virus and they really were knocked out for 3 weeks. So if you're a light, you have a light disease, then it's okay. You can pass it. If you're medium, then you're gonna be sick for about 3 weeks. The problem is that with those patients that are between medium and very difficult, and those patients go into what we call the ARDS. They lose their lungs, and then the whole system is starting to fall down. That's the problem.
Right. All right. Cheryl would like to know, and hey, Cheryl, good to see you on the call. With the high level of infection of your clinical staff, is there enough PPE and training to avoid increased infections? And what I'd also like to know is really, what are some of those challenges, building on Cheryl's question, and you alluded to them, really, what are some of those challenges for having so many of your staff members out of commission? And what roles did they play?
I'm smiling because of that, we had, last week, we had a strike of all the nurses in all over Israel, because they said, we're understaffed, we don't have any how do you say that? Atuda, more nurses that to recruit them once we are in this situation, in an emergency situation. So they just went on strike from today till tomorrow. And then the next day, the government gave 4,000 nurses into the system. So we are understaffed. We work very hard. Actually, since the corona, I've been working like crazy, and all of us. I can't complain. This is my work and this is my life, and I love it. And I cannot complain when other people are losing their jobs and they don't have food in their refrigerator. But it's really hard. It's a challenge. It's really a challenge.
You know, Dr. Sela, between the Syrian, to handling those caught up in the Syrian civil war, and then now this, you've gone from, as we say, from the fire into the frying pan, right? And we hope that it just stops there for you. We want to take some more questions. And again, thank you all for the wonderful questions. This one comes from Layla. She wants to know, what is the difference between the Israeli vaccine versus the ones being tested in the United States now?
I don't know. I don't know what is being tested in the US, but I assume it's the same. I assume they're all working in bringing up a vaccine which integrates into the virus and kills it. There are two different vaccines that they're working on. One from animals, from the COVID-19 on animals that came out and to mutate it to humans. And the other one is to take blood from patients that healed from COVID-19 and extract the vaccine from their blood and make vaccines from this.
Got it. And related to that, Brandon wants to know, how does the Israel vaccine approval process compare to the United States process when it comes to approving the vaccines? Yeah.
It's the same process. However, once it's tested in Israel, it would have to go through the FDA in order to get into the States, which is hard. It takes time.
Right, it's a bit of a process.
Yes.
And thank you to Larry for the following question. He wants to know, what's your opinion of the opening and closing of schools and businesses? From the Jerusalem Post keeps going, he says, from the Jerusalem Post keeps going back and forward.
Come again, please, with the question.
Yeah, basically the question is, what's your opinion of the opening and closing of schools and businesses?
Okay, I think not all the businesses are the same. They all the restaurants, the movie theaters, the theaters themselves, and they closed the buses and the trains. Now they opened the buses and the trains, but for example, my son is a soldier. He's not allowed to go on the train, but he's allowed to go on the bus, which doesn't make any sense for me. You can go on the bus, but you cannot go on the train. You can go into a restaurant, but to sit far away from about 2 meters from each other. I think, people now, they take the COVID-19 very seriously. And I don't think you need to close restaurants and businesses for people because, the leader in Russia said, in Ukraine, he said, I would rather die on my feet than live on my knees. So I don't know. In my personal opinion, I think they should open them with certain kind of regulations that if you don't go by the regulations, you get fines, you get closed. They will close you down if you don't follow the rules. That's the way that I think, because the COVID-19, guys, is here to stay. It's not going away, not tomorrow, not next year. It's gonna stay here, and we're gonna see it every winter. We're gonna see a wave of COVID-19 attacking.
Dr. Sela, in the interest of time, because I'm super mindful of the clock for everybody here as well as yours, we're just going to take 2 more questions from the chat here. And this one comes in from Carlin. Thank you for that. Have you established an evidence-based treatment regime for patients diagnosed with early stages of COVID-19?
No, because the early stages, they don't need treatment. So the light patients, as I said, they don't need treatment and they have mild symptoms of cough and fever. So you just treat them as you treat the flu with fluids and vitamins. We do know that if you take vitamin C, if you take curcumin, if you take ginseng, if you take all those extracts that boost your immune system, then most likely you will heal from the COVID-19 much faster. And to tell you the truth, since March, I think, or February, I'm taking curcumin, I'm taking vitamin C, I'm taking vitamin B, because I'm in the front. I deal with patients on a daily basis. So I take it. I don't lose anything except for a few shekels or dollars from my pocket, but it's better to.
Listen, it's healthy anyway. You should do it throughout
Yes.
the year, even apart from, because all of those spices and herbs, etc., are immune boosters. Dr. Sela, I'm going to take one more question from the group here. This comes from Aaron. Thank you. He wrote, in terms of therapeutics, I understand Israel is working on monoclonal antibody theory. What is the status?
I don't know what is the status because they don't want to say, they don't come out in public because the lab that will come out with the vaccine, they're going to be billionaires. So they're not giving out any information about their status. It's you know, it's to save the world, but actually it's to the pocket for those who are working on it.
Right. Dr. Sela, I think that you wanted to share 2 more slides, didn't you?
Well, it's about I can take more questions. These are the research that we did. If you want, I can show it to you. These are two things that
I'll tell you, why don't you just show them just real quickly, and then we'll wrap it up right after that. How's that?
Okay, perfect.
Okay, if Sarah, you want to show the slides, great.
So this is the vaccine that we did the questionnaire for doctors, nurses, and general population. If the vaccine will come out, would you take it? And if you would not take it. So most of the answers were towards the influenza virus, that they would take it, but the COVID-19, you see, is much lower. If you move to the next slide, this is a paper that we published, United by Hope, by Divided by Access. This is actually one of the same time that we were talking to one of my doctors, and I said, look, let's check, you know, how accessible the information with the WHO worldwide. And if you take the next slide, we looked actually for those with hearing impaired and those with blind or short-sighted, how accessible is the information for the COVID-19. So we rank them green, blue, yellow, and red. The red is on the right there. I don't know if you see it. Those who are fully accessible, partially inaccessible at all. So if you take the next slide, and you can see the countries that we graded them in Europe, in Northern America, Central America, South America, Asia, and you can see those that they have a very good access for the information to the COVID-19, and you can see those who don't have. And this is where we went into the government sites that should be accessible to all the population. And you can see the differences are very high. And you can take the next slide and you can see it in the graph. Oh, I took it out. So that's it. That's what I wanted to show you.
We'll trust you on that one. Dr. Sela, this has been just fantastic. Just real quickly though, before we wrap, just 2 very, very quick things again. So you've been coping how? I mean, you and your family, you said you've been trying to stay healthy through it, but I would imagine it's been a very, very big challenge for you and your entire family.
Well, yes. First of all, you know, on a personal level, I didn't see my parents. Now we're seeing them, but in the first wave, we didn't see them. And actually, my son I have a 12-year-old son. This is my youngest son, and and my mother is living a few blocks from here, and we didn't see her for about 6 weeks, and they're very attached. So last Purim, actually, the holiday, I bought him a dinosaur costume, which has air vents from the sides and the whole, and he's inside this dinosaur. So he took this dinosaur, put it on, and we went to see my mother. And she opened the door and she saw this dinosaur and she didn't understand in the beginning, but through the, you know, there's a nylon, there's a window that she could see that it's him. And it was so this is how we coped, but
yeah. It works better than a mask. We should all start buying dinosaur costumes, exactly. Right? Yeah. Well, listen, I want to really close now by saying, and before I hand it over to Sarah, that, you know, I had the good fortune of visiting the Galilee Medical Center earlier on, when was it, last February? That's where we first met, a year ago, February. And we do want to say that you all love to have people coming from overseas, right? And exchanging ideas and exchanging knowledge and so on. And the Galilee Medical Center, during non-COVID times, of course, is involved in programs like medical student externships. It's a month-long residency. at the medical center, medical professional exchanges, 1 day or more immersion in the Galilee Medical Center departments, and so on. So you're doing a lot of exchanges over there with doctors from all over the place, not just the United States. And of course, JNF has Doctors for Israel, and I know many are involved, but you are doing that. And that's got to be quite a wonderful experience for you, just to have that exchange of ideas, right?
Yes, that's very, it's a mind storm. It's very good. I would like to say good words for the JNF, because I first encountered the JNF in the Galilee Medical Center, which I didn't know. And then I was exposed to what you guys do in Israel, and mainly in the periphery of Israel, which is left out, unfortunately. And thank you very much for what you're doing for us in the periphery of Israel. And keep up the good work.
All right. And we're going to end it on this note. Larry Gilbert says, thank you. The more information, the better. And so that's what we're trying to do here. And Dr. Sela, we thank you so much for your service, for all of your information today that you've shared with us. We look forward to having you back on another call very, very soon. And stay well, healthy, our best to your family. And we're going to hand it over to Sarah right now.
Thank you very much.
Thank you, Dr. Sela, so much for your time, attention, and your presentation. If you were inspired by today's discussion and would like to get more involved, there are many ways to do so. Speak with your local DFI chair, board president, or JNF professional to discuss ways to help engage with your local Doctors for Israel chapter. Host a virtual Doctors for Israel briefing for your colleague and healthcare community members. During this time of social distancing, Jewish National Fund USA wants to help you feel closer to Israel. If you like today's call, you will love our #1 podcast, as we mentioned earlier, hosted by Stephen Shalowitz. New episodes come out every other Wednesday. Check it out at jnf.org/IsraelCast, or you can find IsraelCast wherever you download your podcasts. To hear more specifically from Dr. Sela, please listen to episode 61. You can also stay engaged and connected by watching other great Jewish and Israel-related content at youtube.com/Jewish National Fund. Thank you all for attending today. And again, big thank you to Dr. Sela and Stephen Shalowitz. Have a great rest of your day.
תודה רבה. שלום.